Welcome, everyone, to Monroe Clinic's To The Point. I'm Kent McConnell, together today with Dr. Katiebidu, a pediatrician at Monroe Clinic. And Dr. Rebedew, welcome to The Point.
Thank you. Thank you so much for having me.
Dr. Rebedew, if you wouldn't mind giving our listeners some information about yourself, such as what made you become a doctor and perhaps why you chose pediatrics as your specialty.
Well, throughout both high school and college, I worked at Hoofbeat Ridge, which is a horse camp in Mazomanie, Wisconsin. I loved the horses, but I also loved working with the kids, seeing them learn and grow over the course of a week or seeing them learn and grow from summer to summer. With that experience, I also found out that I enjoyed the first aid I was able to learn at camp, both for the horses and for the humans. In school, I always enjoyed learning about science and enjoyed my science courses. So that combination of loving working with kids, the interest in first aid, and my curiosity about science is ultimately what led me into medicine and then pediatrics.
Where did you study at, Dr. Rebedew?
I did my undergraduate and my medical school at UW-Madison in Wisconsin.
So it's nice that you've been able to stay in the area.
That's great.
Yes. August is National Breastfeeding Month. First, if you wouldn't mind explaining to us, what are some of the benefits of breastfeeding?
Breastfeeding has a number of really cool benefits, both for baby and for mom. Breast milk is able to evolve over time to meet the unique needs of the baby. It also has living cells, antibodies, and other components that help both develop and enhance baby's immune system. Because of this, breastfed babies have a lower risk of infections and hospital admissions. Breast milk also helps set up a healthy microbiome, which is the balance of good bacteria in the baby's digestive system. Breastfeeding and breast milk can reduce the risk of obesity and diabetes later in life for babies. Babies also have a lower risk of SIDS and lower risk of certain types of cancers if they're breastfed. In addition to the health benefits for babies, there are some pretty incredible benefits for breastfeeding moms. Breastfeeding decreases mom's risk of breast cancer, ovarian cancer, type 2 diabetes, and heart disease.
Often we hear parents talk about their feeding goals. Can you share with us what some different goals are and how those can be successfully achieved?
Feeding goals are so individualized, and what's most important is to figure out what works for each baby and family so that everyone involved is happy and healthy. Some families want to exclusively breastfeed, some want to do a combination of breast milk and formula, and some want to feed only formula. Some moms want to directly nurse, other moms want to primarily or exclusively pump and give breast milk by bottle. There are some families who just want to make sure babies get that colostrum or the initial milk in those early days after birth. There are families that want to feed for 1 month or for 6 months or for a year or longer. Every breastfeeding journey is so different, and I think helping ensure the success is really very individualized and working with the family, working with the mom, the baby, to see where their roadblocks are and how to best overcome them.
What do you think is the biggest misinformation people have about breastfeeding?
So I think there's really a lot of misinformation about breastfeeding. One big one is that people think because breastfeeding is natural, that means it will be easy. That then leads to a feeling that if it isn't easy, something's got to be wrong with them or something is wrong with the baby. Another common one that I hear is that babies can and should be put on a schedule. With trying to put a baby on a strict schedule rather than following the baby's cues and feeding them on demand, generally it ends up meaning fewer total feeds in a day, which can lead to poor weight gain in the baby and lower milk supply for mom. This myth also leads a lot of moms to worry that baby wanting to eat again so soon after having just nursed means something is wrong with baby or their milk. Kind of related to that, a lot of people think, oh, babies will eat, then they'll sleep for 2 or 3 hours, then they'll eat again. So maybe they'll eat 8 times over the course of 24 hours, especially in those early days. The goal that I like families to strive for is at least 10 feeds in 24 hours. And interestingly, one of the popular baby tracking apps did a study and found that the average number of feeds in 24 hours was 16. Related to this, a lot of people think as babies get older, as they get bigger, they'll drink more at a time, they'll go longer between feeds. This often is true for formula-fed babies, but not typically for breastfeeding babies. It's really common for them to still feed every couple hours and never take more than 3 or 4 ounces at any given feed. Another misconception that can be really harmful is that it's normal for breastfeeding to hurt or to be very painful. It's certainly true that in the early days there can be some discomfort as your body's getting used to the new sensations. The initial several seconds when babies latch at a particular feed can be uncomfortable, but significant pain really isn't normal and should be addressed. I find this sense that pain is normal and I should expect breastfeeding to hurt will lead moms to feeling guilty for wanting help to address their pain. They'll feel that it's selfish to want to change something just because it hurts them. But really, if the latch is painful for mom, that means it's also a latch that's not very effective for baby. So by working on getting the latch comfortable for mom, it also helps the baby most easily and effectively get that milk that they need. I think one of the last ones is that a lot of people will come in with this conception that they can't breastfeed because of X, Y, or Z. Things ranging from flat nipples to certain medications to the fact that they're going to have to go back to work or due to a challenging experience with a prior child. In reality, there's so much that we can do to help families work through these sorts of issues. And also, most medications really are safe during breastfeeding. And we've got good resources we can turn to for safety and recommendations. So when families have those sorts of concerns or think, I wish I could, but I can't, it would be great for them to reach out and ask.
We are visiting today with Dr. Katiebidu. She's a pediatrician at Monroe Clinic. And doctor, as a mom, how did your own journey help inspire you to provide breastfeeding support to other parents?
As I've been experiencing my own journey with my daughter, it has really ignited my passion to help support families along their own journeys. In the early weeks, we struggled with a shallow and a painful latch. I remember times when I was crying. I was dreading the fact that it was time to feed her again. I also remember a lot of guilt and tears when I would give her a bottle of breast milk rather than nursing because it was too painful. Because of that experience, I really want moms to know that we see how hard it is. We see what a good job they're doing. I also want them to know that we're here to help them. We're here to troubleshoot. There are things we can do to figure out what's going to work for them and for baby. Also, seeing firsthand truly how much work goes into nursing and pumping has made me realize how harmful some of the pump and dump recommendations can be, particularly because they're often given in situations where it's not necessary. For instance, people will tell a mom to pump and dump due to a medication or a procedure under the sense of, well, it's just to be safe, rather than taking the time to find out if it truly is necessary, which usually it isn't. It's also really made me realize how fortunate I am to have such a supportive work environment when I was pumping and how important it is to advocate for support for my patients' families. And as my daughter has gotten older and I'm now nursing a toddler, I've realized how little we really talk about nursing beyond 12 months and how the support for nursing moms often disappears after baby's birthday. The benefits of breastfeeding for both mom and baby still continue beyond a year, and there are still issues that can arise and need troubleshooting. Things we can see are trouble with setting limits, addressing biting, dealing with clogged ducts as the toddlers are nursing less, or coming up with strategies to wean if mom is ready but maybe the child isn't yet. And I've realized if we don't talk about nursing into toddlerhood, then we really aren't making ourselves as the medical community available to help these families.
Dr. Rebedew, what breastfeeding resources do you have available at Monroe Clinic?
At Monroe Clinic, we have prenatal breastfeeding classes for pregnant moms and their support people. We have a great team of certified lactation counselors. We have some who work on the Family Birth and Women's Center, the birthing unit. We have some who work in the pediatrics clinic, and we have some at 2 of our branch clinic locations. I personally am working to expand the breastfeeding medicine support that I can offer to moms and babies who are having challenges sort of above and beyond the typical difficulties that we see and that our certified lactation counselors see and work with. As a clinic, we are engaged in Greene County's Breastfeeding Collaborative, which allows us to connect with other area resources such as our WIC office, as well as the Greene County Breast Friends Facebook group that offers peer support to nursing moms.
Dr. Rebedew, if any of our listeners want to meet with a certified lactation counselor, how can they do so?
They can do that by calling the Monroe Clinic Pediatrics Department at 608-324-2337.
Dr. Rebedew, thanks for being with us today.
Thank you so much for having me here and taking the time to talk about breastfeeding.
We've been visiting today with Dr. Katiebidu, pediatrician at Monroe Clinic. For Monroe Clinic, I'm Kent McConnell, and this has been Monroe Clinic's To the Point.